Hello, everyone. When we sign off on a new graduate, we're essentially making a promise to the public, aren't we? A promise that they are ready for independent practice. But how can we be absolutely certain? Today, we're going to dig into a new blueprint for assessment, one that's designed to answer that exact question. It's all about moving beyond just grades to something much more meaningful, genuine, measurable competence.
So let's start with the tough question. We all use traditional exams in clinical evaluations, right? They're what we know. But let's be really honest with ourselves. Are these tools truly capturing that complex mix of skills, judgment, and professionalism that makes a great dentist? Or are we mostly just measuring how well someone performs on one specific test on one specific day? It's something to think about.
And look, the evidence on this is pretty clear. This quote from the ACGME really hits the nail on the head. It confirms what a lot of us have probably felt in our gut. Even with the best designed forms, the biggest variable in any assessment is, well, it's us. It's the faculty. Whether you're a bit of a hawk or a dove when you're grading, our individual judgments create inconsistencies, and that really highlights why we need a much more reliable, more systematic approach.
All right, so if we need a better system, how do we build it? Well, the answer might lie in a concept called programmatic assessment. And I want to be clear, this isn't just about a new form or a different kind of test. Note, it's a fundamental shift, a whole new way of looking at and measuring a learner's entire journey. Let's dive into what this holistic view really means.
The most important word on this slide is system. Programmatic assessment, or PA for short, isn't a single thing you do. It's a whole framework. It's designed to pull together multiple data points, things like direct observations, simulations, feedback from the whole team, and weave them together to build this really rich, comprehensive picture of how a learner is developing over time.
So how does this actually work? Well, PA is built on a few core ideas. First, every assessment, whether it's big or small, becomes a chance to learn, not just a grade. We're using a mix of everything, from that quick, low-stakes feedback in the clinic all the way to the more formal, high-stakes exams. But here's the crucial part. For this to really work, we, as faculty, have to develop what's called a shared mental model. Basically, a common understanding of what we're looking for at every stage. That way, all the data we're collecting is used consistently to coach the learner and help them improve, not just to stamp a pass or fail on them.
Okay, so if programmatic assessment is the how, the system we use, that leads to the next big question. What exactly are we assessing within that system? And that brings us to our second key concept, entrustable professional activities, or EPAs.
So what's an EPA? Think of it as a real-world task that really defines our profession. It's something you would actually trust a learner to do without you looking over their shoulder. And that word, entrustable, is everything. This isn't about some abstract bit of knowledge. It's about making the decision to delegate a real responsibility, something like managing a patient with an acute dental infection. That's an EPA.
And this is where their power really lies. EPAs are by their nature observable and measurable. A single, real-world task, like performing a complex extraction, naturally brings together multiple competencies at once: patient care, medical knowledge, communication, you name it. They give us a clear, defensible framework for the decisions we make about a learner's readiness to move forward.
So now we have our two main pieces of the puzzle: programmatic assessment, which is the system, and EPAs, which is the content. The really crucial thing to get is that these are not separate ideas fighting for attention. They are designed to work together, hand in glove, as a really powerful, synergistic pair. Let's just break this relationship down to make it super clear. Think of it this way. Programmatic assessment is the how. It's the entire engine, the philosophy for collecting and making sense of all this performance data over time. EPAs, on the other hand, are the what. They are the concrete, essential units of work that we are actually assessing inside that system. One answers how, the other answers what. And for this model to really fly, you absolutely need both.
So let's tackle a common point of confusion head-on. Are EPAs a form of programmatic assessment? And the answer is a simple no. They are a core component that you use within a programmatic assessment system. Think of it like this. EPAs are the individual building blocks, and programmatic assessment is the architectural plan that shows you how to put them all together into a meaningful structure.
Okay, so this all sounds great in theory, right? But what would this combination of PA and EPAs actually look like in our own Bachelor of Dental Surgery program? Let's try to translate this theory into a practical 10-semester model. We can actually map this out across the whole curriculum. You see, it starts in those early foundational semesters, where learners are mostly just observing and assisting under 100% supervision.
Then, as they move into the developmental stage, they start performing these EPAs themselves, but with the supervisor right there, proactively guiding them. By semesters 7 and 8, we see a huge shift. We get to the competency stage, and supervision becomes reactive, meaning the supervisor is available, but trusts the learner enough to let them ask for help. And then finally, we get to the entrustment stage. This is where we make that ultimate judgment call. The learner has earned our trust and is now practice-ready, performing these core activities pretty much independently.
So where do we start with all this? It feels like a lot, I know. But here are 4 key takeaways for us as faculty. Number 1, we have to embrace using lots of different data points to get the whole story. 2, we have to prioritize faculty development so we can build that shared mental model of our expectations. 3, and this is a big one, we have to shift our mindset to use assessment data for coaching, not just for judging. And finally, it's time to start the conversation, to work together to define what are the essential EPAs that truly define a graduate from our program.
When you boil it all down, this whole approach comes down to one really profound shift in thinking. It's about moving away from assessment of learning, that final judgment at the end, and really embracing assessment for learning, where assessment becomes this ongoing tool that actively supports and drives the learning journey, right from day one.
And that really brings us to the ultimate goal, doesn't it? This isn't just about ticking boxes and meeting standards. We need to educate for what's called capability. That ability to adapt, to innovate, and to just keep getting better throughout an entire career. So the real question we need to leave with is this: how can we transform our assessment to build not just competent, but truly capable dental professionals who are ready for whatever challenges modern healthcare is going to throw their way?